Hello, and welcome to the DC HEAL Apprenticeship Spotlight, where we explore how healthcare employers in Washington, D.C. are shaping the future of the workforce through apprenticeships. My name is Kianna Cooper, and in this episode, we will hear from businesses that have joined the DC Healthcare Employment and Apprenticeship Link, otherwise known as DC HEAL. Today, I'm going to be introducing you to Whitman-Walker Health, one of the healthcare employers partnering with DC HEAL to offer apprenticeships here in the district. We're going to be talking about who they are, why they chose to become an apprenticeship sponsor, what they look for in candidates, and what an apprentice's day-to-day experience might look like. So if you're thinking about applying to an apprenticeship or you want to learn more about Whitman-Walker, stay tuned. Joining me today is Daniel Harris, Talent Acquisition Specialist at Whitman-Walker Health. Thank you for joining us today, Daniel. Do you want to introduce yourself a little bit for everybody?
Yes, thank you for having me today, Kiana. My name is Daniel Harris, and I'm part of the Human Resources team here at Whitman-Walker. I've been a part of Whitman-Walker since 2019, so I'm always excited to share what Whitman-Walker is doing and who Whitman-Walker is, and so that's why we're here today. So I'm excited.
Thank you so much for that. And before we get started with all of the questions I have for you, I want to just start with some of the basics. Can you tell me a little bit about Whitman-Walker Health and the kind of healthcare services that you guys provide?
Yeah, so Whitman-Walker has been a staple in the DC community in the DMV area for over 50 years. And so we offer primary care that's community centered. And so even though we're located in DC and we service the DMV area, we do service people and patients who come to us outside of the DMV area. If they can get to us, we'll see them. We have mental health we have mental health care. If you don't have insurance, if you have insurance, we'll still see you. That's just some highlights about us.
Awesome. Thank you for that. And I am so happy to have you guys as part of our DC Heal program. As a business, what made Whitman Walker decide to want to partner with DC Heal to offer apprenticeships at your organization?
Yeah, so in the continuing of honoring the commitment that we have to the community in DC, this is just another way that we have the capacity to take on now. And so we're excited to bring in apprentices and have them join the workforce so that they can gain the skills and the knowledge in the healthcare field if they're interested. So we're excited about starting this with DC Hill.
Yes, and I know our apprentices are so excited to start working at Whitman Walker as well. And now that we're just a few months away from the apprentices, well, actually, now we're just a few short weeks from the apprentices joining Whitman Walker. How are you guys preparing for their arrival?
Yeah, so we are prepared for the apprentices to start. We added the apprentices to our regular onboarding schedule, and so they'll be starting with the other new hires that will be starting on that date. So, 2 weeks before the start date, they should receive an email from me talking about, the first day and the agenda. So, we're actually ready to go, and we're prepared and excited to bring them on in September.
Awesome. I love that the apprentices are going to get the opportunity to join Whitman Walker. They are Whitman Walker employees, and so they'll have the opportunity to onboard as such. And so that's really exciting. I know they're excited for that. And so, for any apprentices that might be thinking about applying to DC Heal either now or in the future, can you talk a little bit about the types of qualities or skills that you guys looked for when you were selecting your candidates?
Yes. So at Whitman Walker, our tagline is "We see you." So we always look for real human beings that are going to be working with other real human beings in community. So if we're able to see the person and not have the candidate give us a version of themselves that they believe that we're looking for, and if we can see them, then that's a plus. Other qualities is, emotional intelligence in the healthcare field, especially working with community, is a plus. Getting to work on time. I know, everyone. Getting to work on time is really a quality that separates people from other people. And so I always say to get to work about 10 to 15 minutes before your start time so you can get yourself prepared before you clock in. My saying is when you get to work early, you're on time. And when you get to work on time, you're late. So that
Right.
has helped me throughout my whole career path. And I'm starting to notice a lot of people not taking getting to work on time seriously. So I always want to keep that at the top of the quality because there's, patients and clients waiting on you. There's your team members waiting on you. There's a lot of people waiting on you to get there on time so that we can offer the service that we offer to the community. The other thing is, clear communication. It's okay, this is your really your first job for many. It's okay to say, I don't know how to do this, or I need help, or it's very important for for them to open their mouth and say, I need help and I need help in this way. So those are some of the qualities that I think are at the top of the list that I've noticed that, have helped me along my career and I've seen other people be helped.
Well, thank you so much for sharing those qualities, Daniel. And I also agree, being on time is super important, especially when you're working in a healthcare environment.
Hmm.
So, thank you so much for sharing that. And I know our apprentices have been preparing and they have been doing so much with their employability readiness. And so they will be ready to meet these expectations. And that's going to move me into my next question, which is since the apprentices have not started yet, what are your expectations for how they're going to contribute to Whitman-Walker? So, are there going to be any certain impact on operations that they'll have, ways that they'll be caring for patients, workforce development, anything like that?
Yeah, so working in a nonprofit setting and a community setting, we're always looking for new hires to hit the ground running. And I hope that that doesn't sound scary. It's very important for them to, I think I already mentioned this, but ask questions if they don't know something. We understand, there's grace there because we understand that this is their first job. And so, they'll be entering the workforce and hitting the ground running. Typically someone who's able to keep up and do that and have a mindset that they can do that is successful at Whitman Walker from what I've seen. And part of where that comes from is the person is, they're passionate about the work that they do. They want to be there. And then, it's all rewarding at the end or throughout their journey as they go along. So they'll be entering the workforce with the other new hires.
Awesome. Thank you so much for that insight. And so, once they do enter the workforce with the new hires, what will their typical day look like? Either in terms of their day to day tasks, some hands on experience that they might have the opportunity to participate in. Is there anything? Will they be mentored in any type of way while they're on the job?
Yes. So the managers that they'll be reporting to is ready to mentor them. What the day to day looks like in healthcare, inside, that's always, it's just an interest. I get the question, but no day is going to be the same.
Mm-hmm.
And they have to understand that, if they expect one thing coming in the door on that day, it may be totally something totally different that happens or is going on, and they just have to be ready for whatever comes at them, and eventually they'll be able to catch on, and they'll have that skill. But the managers are ready. They'll be starting as health information specialists, so they'll be working with medical records and how that is organized and how that works, and then eventually they'll become a certified medical assistant. So they're really starting at the entry level part of healthcare, where you have to understand the basics of the records and how that works before you can even get to being in the clinical setting, so that when are in the clinical setting, they can understand, um, you know, they can connect the dots a little easier because they started in medical in the as a health information specialist, if that makes sense.
Yes, thank you so much for that. And I think that's also what's so amazing about Whitman-Walker's apprenticeship is that the apprentices are starting in a non-clinical role and then kind of moving into a clinical role. And so they'll
Hmm.
have a very unique look at all aspects of healthcare. And so I'm really excited to see how they progress throughout the next year doing that. And so thank you for sharing that. That was great insight. And so before we close our conversation today, I just have one more question, and I'm sure that prospective apprentices or anybody who's thinking about applying to an apprenticeship is wondering the same. But is there any advice that you would give to somebody who's thinking about applying for an apprenticeship or a healthcare role at your organization?
Yeah, I am big on career path and having an idea of what your career path looks like. You don't have to know what it is. Before the after the pandemic, I don't even before the pandemic, I never liked people to ask me, where do you see yourself in 5 years? Where do you see yourself in 10 years? When I was figuring myself out and still figuring myself out in my career, I never had that answer. That was always a difficult answer because I have no idea, you know,
Right.
where I want to go or what I want to do. But as I stayed in my field, I learned, what I like and what I don't like. And I like this, so I want to go more towards this. And so I always share with people, you don't have to know exactly what you want to do. But typically we ask this question in all of our interviews because we look for people who are more career focused,
Mm.
and typically we ask, like, what does your career path look like? And what we're really trying to understand as an organization, as Whitman Walker, is based off of what you share with us, can we as an organization help you get there? And if we can help you get there, how these are the steps that we can help you get there. But it really starts with the person.
Mhm.
Like the people, like I get a lot of questions of, what does it look like to be successful at Whitman Walker? I've always put it back on the person to ask them more questions because it really starts with the person. We can't, this is your career, and we're offering you an opportunity to, expand on your career at our organization. So you have to give us a little bit of something to go off of so that we can figure out your next step. So I think the career path, that's something that I always want to highlight, if that makes sense.
Yes, thank you so much. That was very, very insightful. And I love the way that you answered that question because I think that that is definitely very important, especially for a program like DC Heal, where we're taking entry level apprentices and we're kind of helping to build them up into who they want to be and what career they want to get into. And so I think starting out, that is definitely something very important to keep in mind. And so that is all the time we have for today. Thank you so much, Daniel, for sharing all of this valuable information and talking to us a little bit more about Whitman-Walker Health. I know I learned a lot, and I hope our listeners also learned a lot. And to our listeners, if you are ready to take the next step toward a healthcare career, please visit our website at dchealthcareers.org/DC Heal to learn more about our program and how you can apply.